This technological lag that we see in public security, in health, in education, we are far behind technologically in São Paulo compared to what's already out there. I'm not trying to reinvent the wheel. This isn't rocket science or something entirely new. I'm trying to introduce something that's already present in some cities and states here. And that can bring a quick boost in efficiency. And in 2 years, you can already reap the benefits of new procedures in the health sector, in education, and in security. So I've been watching the state's indicators with a lot of concern. Finances, the economy, security, health, education. The data is very concerning, right? Yeah, we're dropping positions in the national ranking in several areas. And I think what's missing here is a bolder vision of a management overhaul in public administration. What I honestly think, things haven't changed much since then, both in the city and in the state. I don't see the same pace of change that I see elsewhere. And then people say, it's easy to talk because you're not the one in charge. But I'm comparing it with other states, you know. When I say that, I sent a technical team to spend a few weeks in Piauí to understand how they managed to get the waiting list moving. In Piauí, at a speed that's unmatched by other states in the country. It's something that stands out because Piauí is a case we need to analyze. Rafael Fonteles, who has been a friend for more than 20 years, he's a math whiz, studied at IMPA, and is considered a very brilliant mind. And he's an extremely dedicated manager. What happened now in education, just to give an example from this week, Piauí has one of the best public education systems in Brazil. It surpassed São Paulo. Just imagine a state that has infinitely fewer resources than São Paulo. It left São Paulo behind and now has one of the best ranked public education systems. I'm not talking about private schools, I'm talking about public ones. And São Paulo, while São Paulo dropped 2 or 3 positions depending on the indicator, Piauí moved ahead. It's now in 4th place, ranking among the best education systems. So we added 100 billion more to the health budget in the 4th year. It kept increasing, right, until it reached 100 billion. In the 4th year, it was 100 billion more than before. This basically meant a 70% increase. The health budget, if you subtract 20 for inflation, it was 40, it was 45, a 50% real increase in the health budget. This was distributed according to the rules of the tripartite commission. There was no favoritism for any governor, nor any disadvantage. Which means that we increased the health budget for all federal entities, including São Paulo. But while in the country, the increase in elective surgeries, for example, was 42%, here it was 32%. So I think we still have a way to go in São Paulo when it comes to making healthcare more efficient. We still have many services in São Paulo that are stuck in the era of landline phones. I'm not joking. Sometimes you have to call someone to find out if there's a bed available, call just to get information. And so to think that you won't have an integrated center monitoring service availability at this point, which is what the UI has, doesn't make much sense. So I think we have to make heavy investments in this area, and the integration has to be global. SAMU has to be part of it. SAMU is not funded by the state doesn't get involved. It's one of the few states in the federation that doesn't help pay for SAMU. And I'm saying this, from the emergency care, from the ambulance, going through urgent care, the UPAs and the hospitals, we have to integrate this system effectively. And I also intend to make a reformulation of the waiting list based on the severity and urgency of care. We don't have as smart a waiting list as we could have. So there are things that are in progress. There are things that are in progress that will only get worse with the action, a comparison that can already be made. So I would like to reject this kind of accusation that the mayor of São Paulo and the governor of São Paulo have been making inappropriately. Yeah, the data is public. I'm bringing data that can be checked on any platform. And it's not true. Keeping on repeating this kind of thing won't help São Paulo. What will help São Paulo is to integrate policies more, to work more closely with mayors, with the federal government, to make public policies in the state more effective. Yes, about technological lag in public security, right? There's a lack of data integration, transparency, and other issues. There are decisions that have been made that I actually disagree with. For example, letting the police officer have discretion to turn the body camera on or off. I think it's wrong. I think that during the period when the cameras were on, it actually helped protect the police officer. A good police officer feels protected with the camera because he has a record there of what actually happened. Even for his own defense in the event of an incident, he is protected. So I think we need to put this kind of technology to work. Modern security systems, they have analytics built into the camera system, so they work in a completely different way than cameras without built-in analytics. So we are very outdated. They tried to procure some more advanced technology through the Mural Paulista, but the program was canceled this past year. They are now trying to rush a public bidding process, which I think was even suspended by the State Court of Auditors because it seemed too narrowly focused, too closed off. So these things, after 4 years, again, we're missing the boat on the changes that are happening now. We are able to update the technology. Another important thing, here's the thing, São Paulo, making promises to the police force and not keeping them isn't good. You claim the salary will be among the top 10 or 5 in the country, but it ends up in 20th or 23rd place. The troops, are not motivated. I have received many high-ranking and mid-ranking military police officers. M. Emilio has been with me, and the complaint is recurring. So there is a problem. But the fact is that today you don't have, for example, you promised to open 24-hour women's police stations. That didn't happen. A woman she's not assaulted on a weekday morning. That's not how abuse happens. Abuse at home usually happens when both people are there, generally on weekends. So if you don't have quick assistance, and if you don't have social services, and that includes the health clinic, the school, everything to report suspected abuse. Some people come in with bruises claiming they fell down the stairs, right? And because she's afraid of her husband, afraid of being beaten again. But the person who's trained to assist her, right? The assaulted woman, the abused woman, she can report a suspicion. Because if she goes to another health center the next month and says she fell down the stairs again, then, an alert will go off. They'll say, hey, wait a minute, what's going on? So we need to modernize the way we serve people, the way we address the issue of violence inside homes and in public spaces. So in public spaces, you need more intelligence. The occupation of public spaces by civilians and the military police has to stay ahead of crime and not reacting to crime the way it does today with these cameras that have no built-in analytics. That can be done as well. Another very important thing is to financially suffocate organized crime. And you won't do that by defending the state autonomy, because it's absurd to refuse cooperation from the federal government by invoking the state autonomy. What do you mean? If the federal government wants to help you, and if you make use of cooperation, data sharing, information exchange, shared intelligence, and effective action against crime, are you going to invoke autonomy to refuse help instead of carrying out a joint operation together, like it was with the Carbono Oculto case, which is, let's celebrate the anniversary. I just came from lunch with the Federal Revenue Service. They're planning the anniversary of Carbono Oculto because that was a turning point in how the federal police, the Federal Revenue Service, COAF, the Public Prosecutor's Office, and the military police have to operate to fight crime. I always say organized crime only beats the disorganized. Organized crime doesn't win. So if we get organized, and for that, the governor has to take responsibility for public security into his own hands, say, this is my issue. I will do it. So for me, health, education, and security are the governor's responsibility. It's not just delegating it to a cabinet secretary and waiting 4 years to see the results. You have to bring it to your desk to make it happen. Otherwise, it won't happen, you know? That's the truth. And you have to keep your radar on all the time to know what's the most modern thing to make available to the population. So I spent 4 months talking to experts in every field to find out what we could do to streamline this kind of implementation.